Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then try to take actions to make a better system for all of us. We have a lot of topics today, including, of course, appointees by Trump for the next 4 years. We have some comments because they relate to the healthcare world. But before we get to that, let me point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter, which is the text for today's video. You can, of course, go there and subscribe for free. There's no cost for this. But all of the links to research reports and actions and background material and source material, it's all in the newsletter. All of that stuff is free. Enjoy it. So let's get started. Trump, Attorney General appointee, is anti-Affordable Care Act, and good news, she also lacks ethics. In 2018, in her capacity as Florida Attorney General, Pam Bondi signed onto a lawsuit brought to the Supreme Court by over a dozen Republican-led states to overturn the Affordable Care Act. Not just get rid of the mandate, just overturn it, make it illegal. The group was only partially successful, as protections for those with pre-existing conditions and the general framework of the ACA were allowed to remain, but the court ruled that the individual mandate was unconstitutional because they wanted to bankrupt it. The mandate was fined taxpayers who failed to purchase insurance, which was designed to encourage healthy young people into the market, because that's how insurance works. You have a giant population, and then statistically it works out well for everybody. Ask me, I'm a mathematician. The lack of mandate makes insurance far more expensive, and it creates a situation where today, good news, not really. There are 45 million underinsured people in the United States. We'll talk about that in a minute down below. Trump and Bondi also have ties that date back more than 10 years to when Bondi was serving as Florida's first female attorney general. In 2013, as Bondi's office was receiving complaints from people alleging that they had been cheated and scammed by Trump's fake university seminars, her political committee received a $25,000 donation from the Donald J. Trump Foundation. Do you know that foundation? That's the one that lost its tax-exempt status because Trump used it for personal expenses instead of as a charity. I don't know how political donations count as a charity, but anyway. While New York pursued the lawsuits related to the seminars successfully, Florida did not. Both Trump and Bondi have denied that the donation was improper or was related to her not charging him, but that wasn't the only campaign-related scandal during her time in Florida. During the January 6th investigation, Bondi appeared on Fox News denouncing the process as a show trial, and reportedly she was one of a number of Trump world figures, get this, to offer jobs to the key witnesses against Trump in that investigation, including Cassidy Hutchinson. She has like no ethics. Anyway, as the new government offers to take away health care, we in this community will have to dwell long and loud to our legislators to make sure that they have the courage to protect their constituents instead of just rolling over. Let's take an action. This is really important. Please do these. Let's let our senators know who Bondi is and that she is unsuitable. She's unsuitable to serve the public anywhere. You'll send this to your senators. All you have to do is send a text message using ResistBot on your cell phone. The message is sign, S-I-G-N, space, P-T-N-E-H-E. Sign, P-T-N-E-H-E. It goes to 50409. I'll read you the message real fast. I'm your constituent, and I want you to know a few things about Trump's nominee for AG, Pam Bondi. First, when she was Florida AG, they were planning to sue Trump for defrauding Floridians with that fake Trump University. After the Trump Foundation sent her a $25,000 contribution, she chose not to charge. Second, from a healthcare perspective, she opposes the Affordable Care Act and sued the U.S. government to get it canceled. She is okay with leaving Americans uninsured. I am not okay with that, and I strongly urge you to oppose her nomination. Let's talk about IVF legislation that's upcoming. Two House Republicans, Matt Rosendale of Montana and Josh Brecheen of Oklahoma, are asking the leaders of the House and Senate Armed Services Committee to not include provisions in the annual defense authorization bill that expand access to in vitro fertilization. Their letter to the committee chairs and ranking members, first shared with the news source The Hill, is an example of divisions that remain in the Republican Party amid threats to fertility treatment. The topic came to the forefront after the Supreme Court overturned Roe v. Wade, spurred by social conservatives' false belief that life begins at conception. Does not begin at conception. It begins when the egg gets attached, and it's a fetus then. It's not a baby. Don't kid yourself. Even as President-elect Trump and the majority of vocal Republicans say they support IVF, guess what? This host of fools does not. Okay, the defense bill is going to come up. If this thing shows up, we'll take an action and we will scream long and loud to get that thing removed. Let me talk about the underinsured in the U.S. We hear a lot about those that are uninsured. There's about 8% of the population is uninsured. It's about 25 or 28 million people, but 23% of us are underinsured. The Commonwealth Fund has just released a new biennial survey of insurance coverage in the U.S. I have a link to it in the newsletter. You can go read it. It covers adults ages 19 to 64 who had insurance, who didn't have insurance, who didn't have enough insurance. So here are the stats. 56% of U.S. working age adults were insured all year with coverage adequate to ensure affordable access to care. 9% of adults were uninsured. 12% had a gap in coverage over the past year, and 23% were underinsured, meaning they had coverage for a year, but they didn't provide them with affordable access to care. That's typically because the deductible is so high. These are catastrophic policies. So high. If you have a $15,000 deductible, you pay the first $15,000, and then the insurance company thinks about contributing. People don't go to the doctor when that's the case. Anyway, among adults who were insured all year but underinsured, 66% of those had coverage through an employer. Can you imagine their employer is providing crap like that? 16% were enrolled in Medicaid or Medicare. 14% had a plan purchased in the marketplaces or the individual market. Nearly 3 out of 5, 57% of underinsured adults said they avoid getting needed care because of the cost, and 44% of them said that they had medical or dental debt and they were trying to pay it off over time. Bottom line, tens of millions of Americans get health insurance that is useless. They can't afford to use it, and when they do, they go into debt. 23% of us, that's 45 million people. The answer is to make health insurance available that everyone can use to prevent serious illness, repair us when we're sick, without the promise of debt or bankruptcy. I'm pretty sure our elected representatives have no idea this is going on. Guess what? Let's give them the idea. Here's the action we can take. Let's let our senators and members of Congress know about this deplorable situation. You can send a note to your senators and representatives. Just send the text message, sign PHSHT. That's sign sign space PHSHT to 50409. Here's the message you send. I'm your constituent, and a new Commonwealth Fund report details how many of us are underinsured for health care. We have no insurance part of the year, or our policies have such high deductibles we won't use them. The result is that illnesses progress to become very serious without attention, and then the debt mounts, and for so many of us, bankruptcy is the result. It is 23% of the population aged 19 to 64, about 45 million of us. I know that you want people to be as healthy as possible. So I want you to address this horrible gap. You have choices. You can expand Medicaid. You can increase ACA subsidies. You can ensure everybody has health insurance by creating a public insurance trust. Just get in gear and start protecting the people who elected you. Here is a link to the Commonwealth Fund report for you and your staff. Thank you. I have one more topic for you. It's on tariffs and generic drugs. And this is really from the I didn't think it through department. The cost of generic drugs for so many people could go up if President-elect Trump follows through on his promise to impose sweeping tariffs on products from China and other foreign countries, policy experts have identified. During his campaign, he proposed blanket tariffs of 20% on anything that comes into the United States and a minimum of 60% on anything from China. This guy is loco. Anyway, very few generic drugs are actually made in the U.S. 80% of them are actually made outside the U.S. This is according to NBC. Moreover, generics account for, I didn't know this, 90% of all prescriptions filled, according to the Association for Accessible Medicines. That's a generic medicine trade group. The U.S. does not have the capacity to manufacture generics in place. There is no industry that tariffs are protecting. We are also dealing with a shortage of many life-saving medications, including chemotherapy drugs and IV fluids, as well as several common drugs to treat pain and ADHD. Currently, there are 277 drugs that are already in serious short supply and have been in short supply for more than a year. Any kink in the system, in this supply chain, including natural disasters, leads to shortages. That's what happened this year when catastrophic flooding from Hurricane Helene struck a facility owned by the country's largest IV fluid manufacturer, Baxter International, in North Carolina. What we need is resilience and redundancy in drug manufacture, not tariffs. Okay, look. Here is an action. This is genius. My wife came up with this. I love it. Before Trump and his ilk implement tariffs, I want you to stock up on the drugs you need. Make sure you have a ready supply that's going to last you for a while. Your doctor can help you with this. This may protect you for a while from supply chain disruptions that may make your drugs just completely unobtainable. Not just that the cost goes up, but if the tariffs go up so high and the supply chain is broken, you won't be able to get them, period. Stock up now. Let your doctor know and get on it. P.S. If your insurance company gives you a hard time saying, oh, it's not time to refill your prescription, go use a discount card. Use GoodRx or one of the other ones. When you go to the pharmacy, say, what's the cheapest way to buy this? And they'll tell you. They'll tell you which discount card gives you the lowest price. Okay, that's what I've got for you. This is really important stuff. Please pay attention to it. Down below, you can like, share, subscribe. Send me comments here on YouTube or at healthcareadvocacy1@gmail.com, and we'll talk to you shortly. Thanks. Have a good evening.